Okay, so it is now my great pleasure to introduce a person with whom I've had the pleasure of working both at the Public Health Conference and also in class, Shadi Mojtabavi. So, welcome.
Great, thank you. Can everyone hear me okay? I can't tell if I'm connected. Hey. Okay, so I'm going to tell you a little bit about the project that I worked on. I did my practicum at UBC School of Population and Public Health. Within that department, there's the Human Early Learning Partnership Institute, or HELP, and it's a research institute where they do great research on early childhood development. Now, one of the branches of HELP is the International Research and Initiative Program of HELP, or iHelp, and they basically do the same sort of research but at international level. And one of their focuses is looking at a rights-based approach to improve children's health. And iHelp was where I did my practicum. So when we talk about child rights, we have to talk about the United Nations Convention on the Rights of the Child, because it's the most widely ratified human rights treaty in the world. The idea behind the convention is to improve children's health by improving the environments where they grow up. 193 countries have ratified the convention, except for 3, South Sudan, Somalia, and United States. Basically, when a country ratifies the convention, they're obligated to provide reports on the status of their children every 5 years, and these reports go to a small branch of a body of the convention, which is called the Committee on the Rights of the Child, or the Committee. So the committee is basically a group of 18 individuals who do this on a voluntary basis, and they are in charge of reading all the incoming reports from all the countries. And they're experts in the areas of law, child rights, child health, and development. Over the years, the committee has identified a number of problems associated with the report. And unfortunately, I don't have time to talk about it today, but one of the most important things one of the issues is that because the committee has no jurisdiction in the UN countries, there's no system of accountability. They can't go into countries and force them to write better reports or submit their reports on time. And that's one of the areas that's a big concern. So that is why, in 2006, International Help was invited by the committee to put together a group of experts that would come up with a tool or some sets of indicators that would help with this reporting problem. And they did. They developed Early Childhood Rights Indicators, or ECRI, which is an online tool that's now sitting on HELP's website. And basically, the idea is for ECRI to simplify the process of data collection for countries, because that's one of the challenges they have, to bring in all the information and be able to write better reports. There are 17 indicators in this tool. Each of the indicators covers one concept of child rights. So right to education, right to breastfeeding, right to protection against violence, and so on. Just a very simplified overview of what the tool is like. For each of the 17 indicators, there are a set of questions, and some indicators they only have 5 or 7 questions. Some of them they have 60. So when someone's filling out these questionnaire or the tool, the core of these questions is to find out if that country has any policies, programs, or initiatives in support of each of those questions. And if the answer to that question is no, that means they've just identified a gap in their system. So if a country says, oh, we actually don't have any initiatives about this question of that indicator, so that means there's a gap. So one of the features of the tool is, in that case, there are a set of suggestions that are generated. Nothing too comprehensive, nothing like a step-by-step guideline, but sort of just like a starting point as to help them fill this gap. So there are examples from some developing countries who have done it. So basically saying if they've done it, for sure you can do it too. There's some links to policy documents, some great websites, and these suggestions are very helpful. And my job was to update all these suggestions for all the questions, for all the indicators of the tool. So I had to basically look at every initiative, every policy, every program that was out there and add it to the tool. Source of information, Dr. Zibavargi, my supervisor, she was very knowledgeable. She co-led the team that initially created ICRI with Dr. Clyde Hertzman, so she was very knowledgeable on this subject. Google search, obviously, was my friend. Few websites that I visited quite often because they had great information on what I was looking for. Concluding observations are actually documents like a report card that the committee generates in response to the reports that they receive. So they're great resources because the committee actually outlines, they said, we're very concerned about these areas you've just included in your reports. We suggest you do this? So I would actually get ideas from those suggestions as to which ministries or which governments to visit. Results, total of 284 questions that was in the tool. I updated them. I was very impressed with some of the examples that I found. Yeah, I have time to give you a really quick example. One of the indicators is about the right to birth registration. Nigeria has a very good system. It's called rapid SMS. So for every child that's born, they can just send a text message and that automatically registers the child. So it's actually been very instrumental in increasing the rates of birth registration. And Bangladesh, they offer money incentive for families to go in and register their kids. There were also some indicators that had some very strong policy documents, such as right to education, right to protection against violence. These are very solid indicators, very in-depth and comprehensive, and they're examples from all around the world. But there were some other indicators that unfortunately they were not as well developed, such as for marginalized communities or individuals with disabilities being able to access healthcare. So, there were some areas that unfortunately were not as impressive. And even though my goal was to try and find examples from developing countries, often I had to just stick with what I had from the developed world. Challenges, obviously this was a huge task, and you can do this forever and there's still work left to do. So, my suggestion was that they need to update this tool every year because it had been 4 years since the last time they upgraded it or updated the tool. So there was a lot of work to be done, a lot of dead links that, that I needed to fix. Also, some of the indicators, they have a very abstract nature. So there's an indicator called positive agenda. So this was like, what? How can I update this? So there were quite a few of those. And obviously, because I was primarily looking for policy documents and gray literature was my source, I was restricted to only using Google for my information. So the idea for ICRI is to be able to use this tool to be able to increase compliance to report writing, because one of the issues is that countries just absolutely hate writing these reports. It's just too much work. So we're hoping that this tool will simplify that. It has actually successfully been pilot tested in Chile and Tanzania, and great results have come out of those. Another good thing about this tool is if a country, not just for the purpose of report writing, but if they actually start using this tool over the years, you can imagine this becomes a great database of all the resources they have. So in like 20 years, they have 20 years worth of knowledge on status of their children that's been accumulated on this tool. And obviously Canada being the host of this tool, it's great for our global image. It just shows our commitment to children's rights and children's health. Implications for public health, clearly it brings more focus on young children because a lot of the reports, they focus on older kids from 9 to 18, and the little ones from 0 to 8 are often neglected. And as we know, it's those first years of life that are most important. They actually have lifetime effect on our health. So, and also, effective data collection, which was a big issue, so this tool hopefully will help with that, facilitate the process. And I'd like to thank Dr. Zibavargi for her patience, and she actually met with me every week, and we went over all the indicators, so she helped me update this tool. Kathy, Victoria, Dr. Redding for being my second reader, Betty, School of Public Health, and all of you guys, thank you so much for the journey. I appreciate it. That's me, and I snuck this in, and these are all the indicators. Thank you.
thank you so very much. Are there any questions or comments? Devin.
Hello, Devin
Hi.
in the BA program.
Hi.
I really enjoyed your program or your presentation.
Thanks.
Obviously, all these indicators are universal ideas. However, I wonder if you could speak to the just each country has its own unique culture, obviously too, and like being like not just applying like a Western lens to a whole huge world,
Right.
and if there is any element to get around that.
Of course, some of the questions, actually most of the questions that are in each of these indicators, they actually do cover cultural aspect. So they say, in your culture or in your country, do you have, and the other important thing is that all of these indicators, we didn't just make them up. They were actually, they came up with these 17 indicators based on the guidelines provided by the convention. So there are 8 clusters of guidelines, and all of these 17, they fall under those 8 clusters. So these are actually universal indicators that any country has to respect regardless. And the questions that are under there, they're not really targeting the Western world. They're just in general. It's all about kids. So if it's talking about gender inequality, it's yes, there are countries that have that problem, but that's something that they really need to work on. And the tool generates a heat map at the end of the tool. So if they actually get bad scores on that, it's just reality. That's just something that they need to work on. It's too bad.
Hi, Shadi. First
Hi.
of all, great job on your presentation,
Thanks.
and it sounds like a huge undertaking that you took for your practicum, so kudos to you.
Thanks.
I was just curious, for a country such as Canada with so many variation between provinces and health authorities, municipalities, who's responsible for measuring this and based on what? I'm just curious.
Canada is actually one of the countries that's been getting the worst feedback because we are just terrible at writing these reports. Like you mentioned, our report comes from different provinces. Each province has a different department that's responsible for putting these reports together, and then we put it all together again. Each time somebody else is responsible for putting it together, and then we send it off to the committee. And in fact, the last report that we sent in 2012 was over 10 years late. So, and our last concluding observation, our last report card, the committee expressed a lot of concern about Canada's report. So you're right, there are a lot of countries, especially because of the structure of the government like ours, it's just that's one of the issues that reports are suffering because of that.
Shadi, thank you. That was great. Thank you.
Thanks.
What comes to mind when I hear that and I look at your indicators is the use of, you mentioned SMS technology as far as the data collection. Is that something that you noticed at all being used for countries to submit their data?
Yes, when this tool was initially pilot tested in Tanzania, it was in paper format, so they actually took suitcases of the tool with them, and then they realized that in Tanzania, every ministry, every department, even in the most deprived areas, they have computer, they have internet access. So then they digitized it for the Chile pilot, and that's something that they realized if they have access to it, then most countries can actually access this tool online. Yeah, you're welcome.
Okay, great. Thank you so much.
Thank you.
Very good. Yay.